Hi everybody, it's DeeDee Voisey again, your Sheshatshiu Innu First Nation public health nurse. Karen Williams and I are trying our best to stay ahead of all the information and make sure that the community only receives from us what is valid and true and research-based, keeping you up to date with only the latest and most accurate information. I'd like to take the opportunity to just address two questions that came our way since yesterday. One question that we were asked was regarding pregnant women and whether they have an increased risk of serious outcomes or complications if they were to come in contact with the COVID-19 virus. And the answer to that, based on information from the World Health Organization and the Public Health Agency of Canada, is that no, at this time, there is no evidence to support the idea that a woman who is pregnant could have serious complications as a result of this virus. We know that women who come into contact with things like the flu virus may be at an increased risk of complications. However, at this time, there is absolutely no evidence to support that a pregnant woman with COVID-19 is at an increased risk of serious complications. It's still important for pregnant women in the community to be sure that they are extra vigilant with hand washing, social distancing, and surface cleaning in their home of high-touch areas. The reason for this is because some women do have underlying conditions such as gestational diabetes, type 2 diabetes, high blood pressure, and a variety of other underlying medical conditions. If you have these, you are aware of them if you've been attending your prenatal medical appointments. So for that reason, we still would like to see our pregnant women being extra vigilant to support and protect your own health and the health of your children and other members of your household. It's also really important to make sure that you do limit visitors. I see that people in the community have been really great at this, extra vigilant, putting signs on the doors, telling people not to visit, sharing Facebook updates and other social media updates, telling people, do not come to my home, I don't want visitors, I'm keeping my family safe by closing my doors, and that is wonderful. Thank you all for doing your part. Another question that we had was about the safety of your unborn baby if you do come into contact with the COVID-19 virus. Please be assured that at this time, current information does not suggest that a baby is at an increased risk while they are still in the mother's womb. So remember, the COVID-19 virus is not transmitted to the fetus during your pregnancy. Another question that has come my way is regarding breastfeeding. Remember everyone, I'm an international board certified lactation consultant. I have to keep on top of breastfeeding information. This information comes from the World Health Organization and the World Association for Breastfeeding and other trusted breastfeeding professional resources. At this time, there is no evidence to suggest that breast milk transmits the virus to the baby or anyone else. There are safety procedures to keep in mind if a mom does have the COVID-19 virus. She may still breastfeed if she is feeling well enough to do so. The important thing is to make sure that she washes hands before and after breastfeeding and that she wears a mask to protect the newborn baby or any age baby from transmission of the virus through her own coughing, sneezing, and talking. If the mom is not feeling well enough to hold and breastfeed her baby herself, she may be encouraged to pump or hand express her milk and have the baby fed that milk by cup, spoon, or whatever other method she would normally use. So we've had a lot of questions about ibuprofen and the coronavirus. Your Sheshatshiu Innu First Nation public health nurses have used trusted sources of information such as the World Health Organization and the Public Health Agency of Canada to research the internet claim that's been circulating all over the place in the last day or two regarding ibuprofen worsening COVID-19 virus. At this time, there has been absolutely no research to support that claim. I'm going to repeat that again. The claim that ibuprofen worsens the COVID-19 virus, not supported by research at this time. However, please keep in mind that information is being updated daily, sometimes several times a day. Again, I urge you, please, if you are trying to check on information, go directly to the source. Go to who.int, or FAC can be found at canada.ca. Ibuprofen, however, is not recommended for certain medical conditions or to be taken along with certain medications. Please check with a healthcare provider, either your doctor, your regional nurse, or the pharmacist if you have questions about medications combined with ibuprofen. If you have other questions about COVID-19 or ibuprofen, breastfeeding, or pregnancy, please contact Karen or myself. My number is 497-3837. Karen can be reached at 497-3833, and after 4 or on the weekends, you can contact us at 899-3190. If you find information on the internet and you're not sure about it, or it does not come from the World Health Organization or the Public Health Agency of Canada, please contact myself or Karen either by telephone at the numbers I mentioned, or you can inbox us on Messenger so that we can help you verify or deny whether this information is true. Please remember, we can't believe everything that we see on the internet or on the news, because there are many times when the news has to retract their information. Thanks everybody, we'll see you again soon.